everyone. This video is going to explain the process of taking the perfect photographs for either crown and bridge or for full arch restorations. We're going to go through and we're going to explain the photos, why to take them, and then we're going to give you some really good examples of some photographs that we love to have to make your cases special. So what we're going to do first is we're going to, this is what we recommend this, is to take a piece of tape or something that is perfectly horizontal and put it against a wall and then line the patient up with either the eyes or the ears even with the line. And that way we're off to a good start, a nice balance in the face. Then what we're going to do is we're going to take 3 full face photographs. And in the video, you're kind of far away from the patient. When you have either your SLR camera or your cell phone, you want to be up much closer to the patient and you really just want to bracket the face. Don't take the camera too far back because when you zoom in and crop, it gets all faded and we want to see the detail of the teeth and the face and the lips. So what we're going to do is we're going to take the first photograph and that is going to be a patient just saying, lips at rest, right? So just say, and then when you say, just hold it. That's the first picture. Second picture is we want a full smile. Not an exaggerated smile, but a full smile. And you'll find that a lot of patients, because they're in the need of dental, they're not going to take a full, exaggerated, big full mouth smile because it might be a little embarrassed at their smile, but we'll do our best. So if you could please just make a full smile. That's perfect. That's the second one. And then the third one, a lot of it's for full arch cases because we really want to see where the gums are. We want to see where the tissue and the lips and the gums meet. And we don't want to have any surprises down the road. So we want an exaggerated smile like you just heard the funniest thing ever. That's your third full face picture. And then what we'll do is we'll take profile pictures. Now, if a patient is not having any issues with class 1, class 2, class 2 or class 3 or lip support, don't really need to take the profile pictures. But if you are, and these are full mouth reconstruction cases, take the profile picture. And the first one will be just the patient, just like this, without a smile. And then the second one will be in a full smile. Maybe even a little bit more of an exaggerated smile. Those are the 5 pictures that we want for full face, full smile, or full face. All right, now we know what 5 pictures we want. Let's talk about some things that we don't want. And that is, a lot of people today when they take pictures, they take selfies. And they take their camera and they text it to you to send to us and they have it as a selfie looking up. Or they have it at some angle because it's a glamorous shot. We don't want those. We want the camera of a cell phone lens to be at the same level as the nose and we want it squared off. We would really like to have somebody else take the picture besides the selfie so that they can really line the camera up and get everything just right. But don't be tricked by where the lens is. You don't want the lens up here in front of the face. You want it right down here, right in front of the nose. Take a picture, square it up. So that's really important. And another thing that we like to have is that the camera is close to the patient, right? You want to frame the head. Now you can be back a little bit, a couple of feet. But if you start moving back to the back of the room and then we crop and zoom in, it's faded, it's pixelated. We can't really line up the teeth with the photograph so that we can overlay the patient over the smile. So bring it in close for a full face, and then bring it in really close for just a smile image, which we're going to show you some examples of those too. So practice, try to get some really nice photographs. If you want to, send us a bunch of your staff, and we'll help you analyze and make sure that's exactly what we're looking for to do the best job for you.